Between 2012 and 2019, the Ministry of Health's budget allocation increased from 95 million to EC 109 million. The medical benefit scheme's expenditure on pharmaceuticals alone increased by 45% over the 10-year period between 2009 and 2019. As I speak, for pharmaceuticals alone, distributed by medical benefits, it is costing the medical benefits approximately $15 million annually. If you combine that with the burden on medical benefits to cover pharmaceuticals and drugs for the entire nation, it amounts to approximately $30 million. Bear in mind that 2019 is not yet completed, and this is expected to increase. The medical benefit scheme payments for procurement, central medical supplies, government clinics, and the Mount St. John Medical Center increased from $3 million in 2014 to $10.4 million in 2019, and still counting. For overseas medical treatment, the amount spent by MBS in 2009 to 2019 ranges from $1.1 million in 2009 to $5.7 million so far in 2019, and we are still counting. This is an increase of over 400%. Dialysis costs over the 10 years have also increased substantially. In addition to ensuring sufficient financial resources, we acknowledge that we have to become self-sufficient as a nation and not rely wholly on donations and on itinerant physicians for medical care. We have achieved this partially in ophthalmology, where patients are no longer required to travel overseas for some ophthalmology services. The intent being that soon the more common ophthalmology services will be available here in Antigua and Barbuda. We now have urologists and neurologists employed full-time at the Mount St. John's Medical Center, the first time starting in this very year. We envisage that in not too distant future, more cardiology and neurological services will also be readily available here in Antigua and Barbuda. A vital component of universal health coverage is financial access and the quality of services provided. The aim is that no Antiguan and Barbudan should suffer financial hardship in order to receive the quality health care that they need. We see health care as a fundamental human right. I have seen and heard from the scores of our citizens and residents who have suffered financial hardship as a result of unaffordable health care costs. They visit my office regularly to seek solace, seeking comfort, seeking a listening ear, seeking reassurance, but most of all, seeking relief from the financial burden they bear because of medical diagnosis. The government of Antigua and Barbuda says, no more, no more. I say to financial hardship for people because of escalating healthcare costs. No more to persons dying because they lack the financial resources to access services not available in Antigua and Barbuda. No more to persons not being able to access what are considered basic healthcare services in more developed countries. No more inability to quickly respond to catastrophic medical events. Our ambition is universal health coverage in Antigua and Barbuda, where all individuals and communities receive the healthcare service they need without suffering the financial hardship.